This is New Rural Virginia, reclaiming rural leadership through conversation featuring real voices, real issues from the heart of the Commonwealth. Welcome. You are listening to New Rural Virginia podcast, our Candidate Spotlight series. I am Parson Brown.
And I am Larry Wohlers, and we're your podcast hosts. We represent New Rural Virginia, a nonprofit that focuses on the critical issues that will frame rural Virginia's future. So Parson, This is the fifth in our series of conversations with candidates in rural districts for the state legislature.
I know. Happy Pentiversary, Larry, for our fifth episode.
Absolutely. And boy, has it been fun. We've had some great conversations, Joy Powers in 51, Angela Chainer in 56, Jack Bennington in 62, our neighbor here, and Sarah Ratcliffe in 61. And the common thread in all of these is that these folk really share a deep commitment to service, to giving back.
Mm-hmm.
And yet they're each very different, very unique people who can make a real difference, I think, in Richmond.
Totally. And that is why we are thrilled about today's guest, Donna Littlepage, candidate in HD 40, in the counties just south and west of Roanoke. These last few weeks, we've been hearing a lot from people worried about healthcare, not just their personal health care coverage, but really whether rural counties in Virginia are going to have any adequate healthcare service.
That's right.
So we keep hearing about hospitals closing or about to close, doctors retiring and not being replaced, women forced to drive hours when they're giving birth, right? And it really feels like our rural healthcare system is very fragile.
Absolutely.
Well, Donna is someone who hasn't just been talking about the problem. She has been doing something.
That's right. Donna has had an amazing career helping build the largest nonprofit medical system in Southwest Virginia, Carilion Clinic, which is a clinic I had not heard of living up here in Northern Virginia. But, I did a little digging and discovered it's really big. It covers 20 mostly rural counties with 1 million residents. And Parson, it's been so successful. It's won multiple awards for innovation and excellence in healthcare. It's a fascinating, really a unique model, and one that
really is.
As we look at rural Virginia and our healthcare, it's really worth looking at. So Donna, welcome to our Conversations podcast. We have a lot to learn from you. Tell us about what you did, how you folks succeeded, even though, operating in a deeply rural area, the odds were probably against you. What made you guys special?
Well, thank you for having me today. I really appreciate the opportunity to be involved with your podcast. I'm actually a 35-year employee with Carilion, and I just retired last year. And fascinating enough, talk about rural areas, I started my career at Giles Memorial Hospital at the time in Pearisburg, Virginia. So I started my time with Carilion in a very rural area. And Carilion had, not that long ago when I went there, purchased Giles Memorial because it wasn't self-sustaining any longer. And so Carilion had done that and continue to do that for several hospitals in rural areas because it could bring some of the infrastructure from Roanoke to support them, and help those communities. Because a lot of people in those communities, when they needed tertiary care, came to Roanoke. So it was a very symbiotic relationship that these rural hospitals had with Roanoke Memorial. And so as we grew, we paid attention to how do we help those communities? What were the things that they needed in them? And how do we support the individual hospitals that are out there? Because Carilion is made up of 6 or 7 hospitals in total. That's what we did. And we supported those hospitals. We couldn't always support all the services that were needed out there. As you mentioned, having to drive to give birth, Pearisburg doesn't deliver babies anymore. And that was more decisions made by physicians who didn't want to move to Pearisburg. And I think a lot of rural communities have experienced that. You commented on doctors retiring and not being replaced.
Yeah.
It's a little bit of that in terms of physicians deciding where they want to practice, where they want to build their practice. Carilion works hard. We employ doctors as a way to kind of put people back out in those communities when we, in order to support those physicians. So they're not trying to support a practice all their own. And we've gotten numerous times, we have rotated specialists into communities as a way you can support a full-time doctor, but maybe you have a surgeon who comes out there 3 days a week, things like that. So we have worked hard to support that. It's kind of funny. The CFO of Carilion, the current CFO, one of his comments has always been, it's not our money, it's our community's money, because we are a nonprofit and our community is who supports us. And so it's always, how do we invest back into the community to bring them what they need? And we've done a lot of stuff over the years. And if you've read a little bit, our latest announcement is we're building a cancer center, brand new cancer center in Roanoke, bring more diverse treatments to the communities out here in this part of the state. So it continues to do well. And you ask, how are we successful? One, we create relationships with payers and the like that have helped us weather many storms over the years. And also we are an economic driver for this area because we are the largest private employer. Part of our things we've done, you talk about some of our history. We, with Virginia Tech, created the Virginia Tech Carilion School of Medicine. One of the, back in 2008, 2010, one of the first new medical schools when they decided one way to address the physician shortage was to actually educate more doctors. We were one of the first new schools. And so we've been able to kind of make that an economic driver along with the Virginia Tech Carilion Fralin Biomedical Research Institute. So we've been a lot of an economic driver in the market too. So it's been exciting work to do. It's given me a lot of opportunities.
So what is so unique about you is that you really understand healthcare and all of its complexity. So tell us, what if someone like you was in the legislature, what a difference could that make? Like, what would your skills bring to our coming and looming healthcare crisis that someone else could not?
Yeah, I had a lot of opportunities in those 35 years to work with various pieces of the organization. I've worked with virtually every Carilion hospital and every other company we have. And so I understand healthcare financing probably better than most people.
Sure.
And I understand a lot of it related to Medicaid and exactly how the state pays for it. And so as I saw the changes coming to Medicaid, I thought, having somebody in the General Assembly who actually understood how the whole thing worked might be beneficial. And so I dealt with it, working with the payers, both from a financial as well as a population health perspective. I've done both with that, particularly with Medicaid. And I've also been involved from the payer side, because when Carilion owned a Medicare Advantage plan and a managed Medicaid plan, I was responsible for both of those from a financial perspective. So I understand the finance side of it from the payer's perspective. And in 35 years, you get to work with a lot of suppliers and pharmaceutical companies and the like. So I understand the world from their side too. And so I thought, who would be a good person to have in the legislature as you're talking about how do you spend money differently so you keep as many of the services as you possibly can, as many of the people covered as you possibly can, as many of the providers intact as you can. What better person than someone who actually understands what it takes? I tell people that when the lobbyists come to Richmond, and they, from either the payers, the providers, or the suppliers and the pharmaceutical companies, and tell them the story about how they want the legislature to spend the money, I'm somebody who can tell them the other half of the story. Because, people tell you what convinces you to do what they want. And I'll tell you the rest of it and what it actually would take them to be, okay. Right. I have a firm believer, if everybody leaves a little unhappy, you probably made the right decision. But I think there is a chance. I think there's a chance that we can stretch the money because there will be less.
Yes, well, exactly. Healthcare is, especially rural healthcare, has been challenged for a while. But all of the cuts that have been enacted under the recent legislation by the Republicans in Congress means that a lot of big changes are coming down, and Republicans say, hey, this is all just too expensive And they're not wrong about that, right? We spend a lot of money on healthcare, but their answer is, well, we just have to kick a bunch of people off of healthcare. That's how we're going to save money. And we're going to also shift a lot of the cost to the states. So is that, yeah, are they right? Or is there a better way, right? You've seen it.
Well, I want to look and help innovate a better way.
Yeah.
Because everybody needs to have health care. You know, the common story has been, well, nobody's dying in the streets. That's a true statement. It doesn't mean, though, that people aren't dying early.
Right.
Because they don't get the care they need in a timely fashion, because they wait till they're really sick to show up in an emergency room, as opposed to going to their doctor when they have the first sign that something's going on. And then we spend a lot of money to save them.
Yes.
And sometimes we're able to, and sometimes we're not. And so you want the system to be more equitable for everyone. I spent the last 10 years of my career working in population health. And the whole theory in that arena is, how do you keep people healthier so they don't need hospital services? Because one of the ways we can spend less money is if we don't need to spend as much money. If that makes sense.
There's an idea.
Yeah. If you can keep people out of the emergency room and keep them out of the hospital because they kept their diabetes or their high blood pressure, their congestive heart failure under control,
yes,
then you will spend less money. And I think that is an area we need to continue our focus on to figure that out. There's a lot to be said about how people can stay healthier, how we as a country need to be healthier. But a lot of it is understanding disease states and helping people understand how to manage whatever disease state they have. And so I think we showed at Carilion we could do it.
Yes.
And I think it's an area of focus that we still need to have. And I think it helps when you have people in the room that actually have payer and provider understanding about how do we talk to patients and how do we make these things happen. So I believe we can stretch dollars further than we do today with the right people in the room trying to figure out, okay, what if we do this over here? What if we do that? And, you know, to be honest, incentivizing patients to do the things you need them to do. We did a little bit of that
absolutely
in programs we ran at Carilion to get patients to literally go through these educational exercises and how to manage their health. And we would give them kind of rewards if they got all the way through. And it was worth it because we showed that they spent a lot less money, and the little bit I gave them to get them to incentivize to do it, it was worth it. So but there are ideas like that we just need to figure out, how do we do those and not spend as much and stretch the dollars we have further. Because right now, 67% of our funding for Medicaid comes from the federal government. And so there's a big chunk they have that they want to reduce.
Away. Yeah. And one of the sad realities is if you do kick people off of healthcare, then they still get sick, but they wait too long to go in, and then they're really sick, and that becomes really expensive. And then they have to file for medical bankruptcy because they can't afford to pay it, and the hospitals still don't get paid. So everybody loses.
You know, it's fascinating because healthcare is very interconnected. You know, you can say, well, Medicaid, I'm not on Medicaid, I don't have anything to do with that. But I've described healthcare a little bit as a balloon. When you squeeze it on one side, it pops out somewhere else. And that is exactly how this works. It will, if there is uncovered costs in one place, it will get shifted elsewhere. And I think you're seeing a little bit of that in the articles about how commercial insurance premiums are going to go up.
Yes.
And I think that's because that's part of what the interconnectedness is going to do. If Medicaid starts paying less and covering fewer people, then providers are going to have that cost covered. And they're going to look to the commercial payers again. I think keeping the money in the right places, it makes more sense than making it even more expensive on people who are commercially insured, because when employers get big premium increases, they don't necessarily pay it all themselves. They shift part of that to the employees. And so this is something everyone needs to be concerned about, because how we handle this is going to impact everyone.
With all this knowledge, not only of healthcare, but of running big organizations successfully. I'm sure a lot of consultants, maybe even lobbyists, have offered you lucrative contracts, or just have tried to get your attention. Why was it that you decided to run to represent your home district instead?
I had just retired from Carilion, so I was just beginning to enjoy like not having a lot of deadlines and stuff.
Yeah.
And so I hadn't really. I was working on a project. I'm actually the board chair and the pro bono executive director of a newly created nonprofit called the Grove on Patterson, which is a residential substance use treatment center for pregnant and newly parenting women. And so we were getting that off the ground just as I retired from Carilion, and we accepted our first clients in May. And it's like, okay, it's just getting ready to say, okay, I'm now ready for retirement. And I received a phone call in February asking me if I would consider running. That based upon my credentials, they thought I could help. After thinking about it for a while and realizing, I did know a lot about this particular topic.
Right.
And this particular topic is important right now. And so I thought, if the voters will have me, I am happy to go to Richmond and try and help solve this issue, because I would like to help. I have a lifetime of service. And so I'd like to help. And it's kind of funny. A reporter asked me, he says, well, if you lose, will you run again in 2 years? And I said, not unless I can help. I have something in this moment that I think could be helpful as change is underway. And so I'd like to offer it up to the residents of District 40. And to be honest, everybody in Virginia, because I think the decisions we make are going to impact the entire state. And so, like I said, I just have a skill set that might be beneficial. And so here we are.
Felt called to action. I appreciate that.
Yeah.
So you're running as a Democrat, but as you told us before the podcast, you define yourself as a moderate, a centrist. What does that mean for you? How do you find yourself?
Well, I many years ago coined the phrase, I am socially conscious and fiscally pragmatic. I recognize the need to take care of my neighbors, however we might do that, as take care of the environment. We only have one planet. So I recognize all of those things, but I also recognize the fiscal side of it. When you're responsible for doing budgets for 35 years and you have to live within your means, both at home and at work, you learn a little bit about that. And so I don't believe in spending money we don't have. I don't believe in everything you want to do, just tax people more. I don't believe in that. But I do believe in incenting people to do things that help their neighbors, help themselves. And how do we figure out ways to get people to work together? And I am a centrist because, like I said, I think because I put those two pieces in it, I consider myself a moderate. I think there are a lot of us that we don't get heard over all the noise on both ends. And there are probably, and from people I've talked to while campaigning, there's a whole lot of, yes, could somebody with just some common sense go to the legislature? We'd enjoy that. And I think that's what I like to think I have applied throughout my career. There have been challenging budget times during my career at Carilion. During the recession years, I was responsible for the budget when we had a little downturn in our activities and lost $60 million. And we turned it back around as a group. But you learn you have to make tough decisions when you're writing a budget, and that's the situation you're in. And I believe the state may find itself in a similar situation, and we're going to have to make tough decisions. But I think we can and should. Virginia has always been resilient, so I feel quite certain we will be again. And, from my perspective, I just think I can add a little insight on one of the large expenditures Virginia has and hopefully help with some of the others as well. The other thing about being a centrist is, it's when you're in the center, it'd be real easy to be left or right of center,
Yes.
Because I think sometimes the center, we're more alike than people give us credit for. And I think I told you guys, I have never met a Republican who wanted to do harm to their fellow man. I think we all want people to be successful. We want to give them a hand up and we want to help them out when they need it. And I think there are a lot of us like that. And I think we should be talking to each other and not let whether there's an R or D after your name be the sole decision maker of who you vote for. You should vote for people who share your values regardless of what party you normally align with, because, I think there are probably a lot of moderate Republicans who will not find me very different than what they believe.
We've been trying to find ways to come together, to build bridges, because the reality is this election is about choices. But more so in these conversations, we've been talking about just living together as neighbors. What are the key choices that face your voters this election year, and why you, definitively why you and not your incumbent?
Well, we're both accountants, so there's some kind of equal on that one. So you get one, either way, you get an accountant. But I think Joe's been at it a while, and I don't have anything, I'm like going to throw him under the bus or something. I don't really have a lot one way or the other to say about that. I think, like I said, I have a skill set that could be beneficial at this time. Now, he does have one vote that I don't agree with, and that is when a 50-year-old precedent gets overturned. I feel very strongly that the voters of Virginia should get to decide what they want to do about reproductive rights, not 140 people in Richmond. Mm-hmm. And as few as 73, because that's what I tell people, to lose the rights that everyone in Virginia still has because of legislation we have would only take 21 senators, 51 delegates, and one governor, 73 people, to take those away. And if you feel strongly that you don't want to be that at risk, then you would want the opportunity to vote on enshrining those rights in the Virginia Constitution. The way that process works is that the House and the Senate must pass an amendment during one session. There must be an intervening election this year, and then it must be passed again. Mm-hmm. Joe McNamara voted against giving the voters of Virginia the right to decide on this. And I think that was completely inappropriate. And so I would be a yes vote this year, this coming session, to allow that amendment to go on the ballot for the voters of Virginia to decide. And based on what's gone on in other states, that's why it's a little uncomfortable just leaving it to the legislature, because in those states, polling says the legislatures didn't always do what the citizens wanted.
That's right.
And so I think it is a clear issue right now that voters should get to decide. And I'd like to see it on the ballot in November of 26. And so I would vote to put it there. I have attributes and skill set that might align very well with something Virginia needs. And in this case, you'd be voting to put that skill set into Richmond.
As these cuts come down from Washington, and we're going to see it happen quickly in some cases, as with the end of subsidies for the Affordable Care Act, which will happen very soon, more slowly for the cuts in Medicaid and SNAP and all these issues. Really, it's the state legislature that's going to be the only place where we can modify, reduce the pain from these cuts, help people manage them. And so the question is, who do you want to have in the legislature dealing with those problems?
That's kind of what I'm thinking.
Right.
Because I spent a lot of years coming up with innovative solutions to be able to provide the most services we could to the most people.
Yes.
And so I think this is just another opportunity to use that skill set again.
So you're saying we can be fiscally smart and prudent and yet still take care of people.
Exactly. Proven track record of that.
That's right. Thank you so much. It's been a great conversation, and I've learned a lot about what we can do with healthcare. And it leaves me with maybe a little bit more optimism than I've had, because we've just been hit day after day with the sense of, these cuts are coming down and rural healthcare is in trouble. It's just going to get worse. There are no solutions. And what you're saying today is, no, it's not going to be easy, but if you're smart about it and prudent about it, we can make it better.
We can do as much as we can with the dollars we have. I'm not going to sit here and say it's easy and it's not going to hurt.
No.
But the idea is healthcare needs to be a right. People should not feel like they're on the outside of it. And we as a state are going to need to figure out how to do that by finding ways to save money in some places so that we can replace lost dollars in others. But it will be very hard to replace the level of dollars they're talking about. So there's going to be some pain. I don't want people to believe that I've got like some magic wand that can make this all go away. But I do believe that working together with the payers and the providers, we can come up with solutions to make this as least painful as it can be. And having someone from this part of the state actually being part of that conversation, I think is important, because a lot of the other legislators may not know enough about healthcare in rural areas and what it means and what it took for Carilion to build a new hospital in Pearisburg. Because to be honest, there was a large chunk of people, and sometimes I was one of them going, I don't know how we afford to build a new hospital in Pearisburg, Virginia.
Right.
But we did, and it's done well. And, people in Pearisburg were adamant that they could make it work, and they did. And it has been well worth the investment we made. But those are tough decisions in the moment when you're making them. But it's having somebody who understands rural Virginia and understands operating hospitals in rural areas. It can't hurt to have them there in the room when you're making the decisions.
Yeah, there you go.
Absolutely.
Making those tough decisions. Where can people learn more about your campaign?
My website is Littlepage, Littlepage, the number 4, VA.com. So Littlepage for Virginia or for VA.com. They can learn a little about my experience, things I've done over the years, organizations I've been involved with, because I have spent a lot of years being involved in local nonprofits, because I believe that is another place that we can help our neighbors by our own local nonprofits. And how do we support them? How do we make them as effective and efficient as they can be? I've been on numerous health and human service type boards for local nonprofits. And I think there are things that the state can do to support those flourishing to fill in some of the gaps we're about to experience. So it's multifaceted in how you solve for this. And, in a weird way, sometimes upheaval is good. It makes us think through what we're doing and why we're doing it and how we can do it better. And that's one of them that I think that this is a time to take advantage of it. Maybe painful, but let's take advantage of it at this time too.
Yeah. I like that, this idea. There is no one answer. Right?
Yeah.
It's a multifaceted thing, and we're going to have to just keep working at it and learning as we go.
And I love that you're realistic about that. And honestly, I have learned a lot. I know we've talked earlier, but in this conversation, even more every time that I speak to you. So I'm looking forward to the things that you can bring to our state legislature. So thank you for joining us, and we wish you well and good luck.
Well, thank you all. I really appreciate it.
Yes, thank you so much. And we're going to be following your campaign with a lot of interest and excitement.
Yes.
Well, thank you. I appreciate that.
New Rural Virginia Candidate Spotlight is a production of New Rural Virginia. Visit newruralva.org for more. Produced and co-hosted by Larry Wohlers and yours truly, Parson Brown. Thanks for listening. Stay tuned for the next episode.